The Philadelphia area has been one of the hardest hit areas for the opioid crisis. We have actually one of the highest death rates of any large city in the United States.
We oftentimes saw the same patients coming back time and time again. We realized that we needed to do something better. We had to go back and understand what was broken in that relationship.
Traditionally, the ways we tried to attack opioid use disorder really didn't work. Detox and rehab, these are solutions that have low single-digit success rates. But we actually have solutions that do work. We had medically assisted treatment, MAT. We had the certified recovery specialist who had a lived experience, a shared experience with the people we were trying to help. You start to see that we have tools, we have weapons that we can use in this fight and that we just weren't using.
So the core model is really unique in that we're using IT support to identify patients more rapidly and then getting peers to the bedside, and then the patient is speaking with somebody who they have confidence in before they get confronted by a clinician.
Our certified recovery specialists stay engaged from the first encounter in the ED up to 12 months or even beyond, if that's what the patient would like. We know that not all of the patients that present in the ED are ready that moment for treatment, and that's okay. We're going to meet them where they're at. Another piece of this, of course, is getting patients started on evidence-based treatment, which we know means starting them on medications for OUD.
The two most common medications that we put in this category of MAT, medication-assisted treatment, or medications for opioid use disorder, sometimes called MOUD, are methadone and buprenorphine.
Those medications are associated with about a 50% reduction in overall death rate, and that includes both overdose and other causes of death. And they do this by helping prevent withdrawal and reducing cravings.
You know, recovery is a process, and even for folks who are not ready to start treatment, we want to keep up a relationship, maintain a relationship with them. So having the certified recovery specialists there to reach out to folk, maintaining those relationships is really part of keeping someone on a trajectory for successful recovery.
Even when we have a patient who does have a setback or a relapse, they're coming back to us. So we have a number of patients who we've treated maybe successfully or with some struggles, and then they had their issues or they went into a more intensive treatment program and they're coming back to us. Or if they transition to methadone maintenance, they're staying with us for primary care.
I think it's important to remember that we're also changing a lot of lives. You know, we're meeting patients where they're at, helping them to make positive changes, and we're pursuing recovery in the way that works for them. So for a lot of patients, it could be making small changes and supporting them in recovery.
The core program has been really successful. The outcomes that we've seen in only 10 months have really been surprising. When we initially started, very few docs had their X waiver. So not only could they not write a prescription for Suboxone, they didn't feel comfortable using the medication. It was new and it was something they just weren't sure about. And so what we've done is we've gone from 5% of our docs having their X waiver to almost 90. We have now treated 3 times as many patients with buprenorphine than we ever did before the initiative. And along with that, and I think equally important, is that using a CRS has increased 12-fold in the emergency departments. And so even when patients don't opt to start buprenorphine, they are connected almost always with a certified recovery specialist who's going to help guide them when they are ready.